My name is Debbie Shick, and I'm 74, almost 75 years old. The reason that I went to SCOI was because I was having excruciating pain in my right leg, and it seemed to center around my knee. Before I started having the pain, we had a very active lifestyle. We're up at 5:30 every morning and cooking at least 2 meals a day. We travel a lot. We just weren't able to do the standing for the cooking and the entertaining and the family events that we used to do before the knee. I went to my general practitioner. She took me as far as she could, and then she recommended that I go to SCOI.
So when Debbie first came into the office to meet me, she was complaining of significant pain inside her knee. The pain was limiting her ability to do the activities that she wanted to do in her life, and she felt that she needed some help to try to help manage the pain and improve her function. We tried to see that we could eliminate her pain and improve her function without surgery, and when we weren't able to get her to a level that she felt satisfied with, that's when we started to discuss the option of surgery.
I am so happy with the results from my knee replacement surgery. I am completely unassisted now and completely mobile. I walk up and down stairs. I climb the ladder, get in and out of the car. I'm driving myself again, and that's really wonderful to feel independent again. The difference between before and now is amazing. It's 100% right now, and I'm just believing that it's only going to get better.
While me doing the surgery is an important part of the whole process, obviously, the recovery part is really much more involved with the work that Debbie has done in her physical therapy, with her recovery at home, doing the exercises, working on motion, working on strengthening. Those things have really helped her do as well as she's done.
I would describe my experience with Dr. Balch as a comforting, a fabulous, encouraging. I can't say enough about Dr. Balch and his team that help him.